Our mental health moment of the week with Sweetser for families who struggle with their mental health, understanding what support looks like and how to access that. That can be a barrier. So joining us right now to help us understand the issue a little bit better is Sweetser's Clinical Director of Youth Services, Becca Task. Becca, welcome. Thanks for coming by.
Having me.
All right, for children who need immediate crisis support, how and where might folks be able to access that?
So what you're describing is our crisis stabilization units. You might hear them as a CSU or a CRU. We have two, one in Saco, one in Rockport. Think of them as emergency mental health. Instead of going to the hospital, it's an in-home setting, 24/7, clinically supervised, short-term relief for symptoms for families and the youth. They're getting brief intervention treatment, somewhat of a routine to help them get back home and be safe. Average of a week stay, we're connecting them back to their previous services or in need, and you can connect through our mobile team or go to the emergency department and ask for a crisis evaluation.
Okay, there's some action you can take right there,
Yes.
right? Now, if a youth can't remain at home or even at their school because of their circumstances, what are some places that they can go where, Becca, that the family could still be connected?
So those are called residential programs. We have one in Saco again and in Winterport. Those are long-term, highly structured treatment to help find new patterns of behavior that are going to help them go back home. If they're in Saco, they're attending our special purpose school right on campus, which is an integrated behavioral health treatment and school. And in Winterport, they would be working with their local IEP program to find education. It's skill building, it's long-term stabilization.
Gotcha. Well, maybe if we look now long term, what might that treatment look like on a more regular basis?
So for typical outpatient for families and youth, we're talking about our Hope and Healing Centers, which are in Lewiston, Sanford, and Brunswick. We have walk-in access, so you can follow up and go in, get connected, and have appointments hopefully before you leave. If you're talking about families that are using the residential services, crisis, then we're talking about our assertive community treatment program, or our ACT team. Sweetser is the only one in Maine to have it in Saco. It is all the mental health providers and other supports that a family and youth need to help that kid live safely at home. We bring the treatment to them, into the community, or in the office, average of 6 to 9 months.
Wow. So, I mean, even in the last couple of minutes you've been here, you laid out a lot of different pathways for
Yes.
potential help. And if somebody is watching this, Becca, and they want to reach out, what's some ways that folks can get information? What are the options now, and how can they connect with that?
Yes, so when in doubt, reach out, text or call our 988 number, or you can go on our website and go to info@sweetser.org. We will connect you with where you need to go. Some of these services need a formal assessment or a case manager, but we'll point you in the next direction.
Anything else folks should know if they're watching this right now?
No, all of these services are available, so please reach out.
Wow, lots of options there. Thank you so much for laying it all out for us.